Thank you for tuning in to the Missouri Nurse Association. I am Felicia Hampton, the Vice President of Advocacy, and during this session, we're going to talk to Representative Joe Mary of the 78th District. Thank you for allowing us this time. Good morning.
Good morning.
Should we say good afternoon?
Yeah, no, I mean, they won't know the difference.
A great day to you, right?
Yeah, great day, great day.
So, tell us a little bit about your district, and
Sure.
then we'll go into the bills, and a little bit about yourself.
And I appreciate that. I know you have Nurses Run the World. I'll start off by saying that. And I know this is planned to be a series. So when you talk about the 78th District, I like to say it's the best district in the state of Missouri. Mm-hmm. My colleagues like to throw things at me when I say that. But when you think of St. Louis City, and you think about the skyline of St. Louis, that's pretty much my district. So it goes as far north as Old North and St. Louis Place. Mm-hmm. We kind of go down to picking up downtown, and then it travels south all the way to past Cherokee Street.
Okay.
Yeah.
Okay, awesome. So, and you have drafted some legislation to protect workplace in nurses and healthcare providers.
Oh, yeah.
So you have House Bill 1920.
Yeah.
Tell us about it.
So we can talk about House Bill 1920. Where I'll start, though, is my background prior to being a legislator. I spent over a decade in the healthcare space. So I worked for companies like BJC Healthcare, Centene, Cigna. And during my time at BJC, they have tens of thousands of employees, and they did a company-wide survey to say, what are the things that are most challenging to you in your job that's causing, friction in your job? Mm-hmm. And workplace violence was the number one thing that they said the hospital needed to do something about. So House Bill 1920 was really a result of those survey results, mm-hmm. and me understanding that when it comes to workplace violence, that's like an added layer of stress that our healthcare professionals deal with on a day in and day out basis. So the idea, I filed it last year, my freshman year. It was House Bill 901. We did have a hearing, and it was able to get voted out of committee. And this year I'm just continuing that fight. And what House Bill 1920 does is it creates a hospital security fund that we as a body could later appropriate money to for security enhancements. So whether a hospital wants to have, input like a badge system for like doorways and entrances, mm-hmm. invest in security cameras, or I would say security personnel. This fund, they will be able to apply for and be able to get, funding for those type of security enhancements. But what I think is more insightful about the bill, or impactful, is it will require the Department of Health and Senior Service to be able to implement an awareness campaign around workplace violence. I know Representative Phelps has a bill last year that he ran. I think he's running it this year as well for signage. Mm-hmm. I think my bill also has require all hospitals to put, assaulting a healthcare professional is a crime, etc. Mm-hmm. But I think it should go beyond that, because I think there's just this stigma when you think about first responders, police officers. People kind of know, don't put your hands on police officers. I think that same courtesy should be extended to healthcare professionals, because they're taking care of us most often when we're most vulnerable. So that was really the impetus for why I pushed the bill. We haven't gotten it referred to committee yet, okay. But that's one thing that I'm working on trying to get this year.
So let me ask you, is this legislation modeled around or after other policies in a different state? And if so, how is it, what are the outcomes? Yeah. Or do you know?
Yeah. So as far as the impetus for this bill, it wasn't necessarily modeled after any particular one state. This is just a product of conversations with the Department of Health and Senior Services. What we didn't want to do is codify that in statute, what that program looks like, but allow them to have those conversations with the hospitals throughout the state of Missouri to see what that looks like, and allow it to be more flexible in terms of what is effective.
Okay, awesome. And we know that workplace violence is a serious issue in the healthcare setting. How would you get this information once the bill is passed? How will you get this information to those healthcare entities across the state? Right?
I'm gonna call you.
You gonna call me?
And try to get the word out. I mean, obviously we'll do press release and campaigns and such, but I think the idea is that the Department of Health and Senior Services would have those relationships with the hospitals and health service organizations to get the word out about it.
Okay. And so what support do you need from healthcare providers, nurses, and to get this bill to committee?
Well, I would say having conversations, them reaching out to the speaker's office, asking that it get referred, reaching out to the chairperson of health and the health and mental health committee, Melanie Stennett, requesting that the bill be brought, because I think the biggest thing outside even us passing it is giving a voice to the nurses to be able to say this is an issue and the Missouri legislature needs to respond to it, and we think House Bill 1920 will help in some way.
Awesome. And I will say this, I sit on the workforce task force, workplace violence task force for Missouri Nurse Association, and one of the things that we desired was to have something in place, some funding in place that healthcare providers and entities could use for this very issue, for security and for training for security. We need different fundings for stuff like that. So,
Okay.
All right. Cool. So you have a second bill.
Yeah, I got a bunch of them.
Okay.
So many. But we'll talk about House Bill 3099 was probably the more recent bill that I sponsored. And this bill is very straightforward. Right now in our current law, when you look at advanced nurse practitioners, they have the ability to administer and prescribe Schedule II drug hydrocodone. Mm-hmm. And when you look at the state of Illinois and other states, they can have that prescriptive ability around all Schedule II drugs. So what House Bill 3099 is really intending to do is allow them to operate to the full capacity of their education, right? Like when you look at all the training that they have to get, all of the certifications that they have to do to be able to prescribe drugs, it just allows them to be able to practice so that we're not losing nurses to go and practice on the Illinois side of the river versus in Missouri because of those restrictions. Mm-hmm. And I think the benefit of House Bill 3099 is that it pairs well with House Bill 3217 from Representative Overcast. I know you'll be having a conversation with him, but he has a few bills that are around the collaborative practice agreements for advanced nurse practitioners. The idea is that we need to really allow nurses, to be able to function to the full capacity of their training. Mm-hmm. And I think that allowing them to, one, not be so restricted by those collaborative practice agreements, because one thing that he told me in his specific district is right now he has like one physician per however many square miles, and if that physician passes away, those nurses won't be able to provide the care that they need to that population. Mm-hmm. And that's a story that we hear all across Missouri. So our healthcare system is broken, and the idea is that even if we can use the nurses that we have in the state of Missouri to be able to practice, we can increase the health outcomes for patients.
Absolutely, and we can increase access to healthcare, because we know that when we are using our APRNs to their full practice, to their full ability, then we are able to provide that access to healthcare for the Missourians that we serve. Yeah. So thank you for that bill. Anything else that you want to add to this particular bill?
No, I mean, when I look at healthcare, this isn't like a party issue, right? I'm a Democrat. A D is behind my name. But I've seen it all across the state, because even working for companies like BJC, who have hospitals all across the region, all across the state, even with their partnership with St. Luke's or the merger that took place, this isn't a city issue. This isn't a rural issue. This is just a people issue, and we have to do something to address it. So I would just encourage the nurses to reach out to their legislators, send letters, send emails, make phone calls, and ask that this bill be heard in committee and ultimately get to the floor so we can pass it.
Okay, so this bill is not moving as well as what we're saying?
Yeah,
okay.
They're all right now, they haven't been referred. They've only been second read.
So we have work to do.
Oh, yeah.
Yeah. Mm-hmm. All right. And do you have another bill that you want to share?
Now, those are my main focus. I mean, House Bill 1920, I think, is like one of those common sense bills. Like the language that's in that bill has been, some of it has been heard in the Senate and passed. Some of it has been heard in the House and passed. I think that is, when you talk about low hanging fruit, this is one thing that we can actually get passed this year, and it has shown that it has had some traction already. So I think that's a good one for us to try to go after.
I'm going to ask you one last question, because what I see is that subject to appropriation, a hospital can receive reimbursement. And from what I've known, sometimes with the reimbursement, it might be difficult if you don't have those funds available to you, right? So that you can be reimbursed later. Will there be something put in place for that you might think? Or maybe
it's hard to say. I mean,
part two.
Part two. I would love that, like some type of a grant program. I do know that when this bill was heard in committee, we did give thought to make sure that larger hospitals wouldn't just consume the larger pot of the share of the pot. So we did have considerations around that part of it. But as far as reimbursements versus grants, I think reimbursements is the preferred approach in the Missouri House of Representatives, just based on from a budgetary perspective. They like to make sure people are good fiduciary agents of the money being, allocated. But it's something to consider, and I appreciate, your thoughts around that.
Well, thank you, and I appreciate you for taking the time to speak with us and share with us your bills that you have this session. And Representative Joe Mary from the 78th District. Thank you.
The Missouri Nurses Association is the leading voice in nursing advocacy since 1906. Join a community that champions Missouri's nurses, promotes safe practices, and enhances care nationwide. Be part of a network to grow and lead in the nursing profession. Your membership is less than $16 a month. Join us and experience the power of nurses. Together, we're building a vibrant future for Missouri through nursing excellence. Learn more at MissouriNurses.org.